for us here, this One Health agenda is very important because we see this is the logical way in which we can make our country very resilient. And the investments that we are going to make over time are going to be to improve surveillance, laboratory capacity, human capacity. So we really want to build a system where we can respond. So surveillance and our labs and everything must be geared to doing this.
That was Minister of Health Dr. Frank Anthony as he addressed the inaugural One Health meeting, which was held on Monday at the Pegasus Hotel in Georgetown. One Health is a policy that aims to prevent and prepare for current and future health challenges at the human-animal environment interface by fostering collaboration and coordination across governance frameworks of human, animal, plant, and environmental health programs. In March 2022, the Ministry of Health requested the support of the Pan American Health Organization, the Food and Agriculture Organization of the United Nations, and the Inter-America Institute for Cooperation in Agriculture to collaborate in implementing key activities to strengthen the One Health approach in the country. Dr. Anthony specifically pointed out the COVID-19 outbreak in 2020, which he said has left long-term effects on those who were infected and the country's economy. As such, he said it is important to develop systems to prepare for future occurrences.
This whole concept of One Health is how do we combine them? And maybe in the name itself, it's making it one, bringing all the separate parts and make it a whole, and then apply the techniques so that we can see it in a more holistic way.
He further noted that talks are ongoing to develop the capacity at the National Public Health Lab to be able to conduct genetic sequencing to track mutations.
But ultimately, we would like to have that capacity, and not just for Guyana, but to serve as one of the reference centers for the Caribbean. But it's important if we are going to develop this next generation of surveillance to be able to have this capacity.
The One Health inaugural meeting intends to reintroduce and reinforce the implementation of the One Health approach in Guyana among key partners and stakeholders as a strategy for pandemic prevention, preparedness, and response, and as a mechanism to enable the country in its universal health coverage and disease elimination targets. Reporting for the newsroom, I am Sharda Bacchus.